Hello, my name is Ashley Beeben.
I'm Audrey Lewis.
I'm Phil Watson.
I'm Kaz Kowaleski.
Huffing, sniffing, dusting, and bagging of common household goods or substances through the nose or mouth can create a psychoactive effect on the brain. Some examples of the substances include spray paint, other aerosols, markers, gases, nitrates, glue, and cleaning fluid. Inhalant abuse, especially among middle school students, has become a common concern today. And today we'll be looking at the health issue, as well as an agency and program implemented by that agency to prevent the prevalence of this rising health issue. Some short-term effects of inhalants are hallucinations, slurred speech, lack of coordination, as well as other symptoms similar to alcohol intoxication, although highs for inhalants may only last for a few minutes. Some long-term effects are harm to vital organs such as liver and kidney damage, muscle weakness, depression, and brain damage. Some other health concerns include addiction with prolonged and chronic usage and abuse, as well as unsafe sexual practices, which could lead to sexually transmitted diseases due to nitrates being used for sexual pleasure. Sudden sniffing syndrome can be due to heart failure, which occurs at any time, any usage, first time you use inhalant, second time, 100th time, and it can lead to death.
This table indicates prevalence of use among 8th graders from the National Institute on Drug Abuse, and according to this, their studies portray that the prevalence of inhalant substance abuse among 8th graders between 2009 and 2012 has declined in all aspects. According to the Monitoring the Future, the studies portray such prevalence among youth as a decline across the boards too. With records concerning inhalant abuse prevalence among 8th graders from 1991 to 2012, the trend strongly depicts a great decline of participation, which is good, but could indicate use of other drugs in their place. Data taken from the YRBS from about 2,000 southern schools in the U.S. shows that the proportion of children living with both biological parents has declined 50% since 1960. Literature suggests that children from non-intact families are more likely to smoke, use alcohol and other illicit substances, and be frequent users at earlier ages. Although African American middle schoolers were more likely to be in single-parent households, higher proportions of Caucasians are more likely to live with both parents and try inhalants. More Caucasian males tried inhalants than females, and more African American females tried inhalants than males. These substances are easy to obtain, they're relatively inexpensive, and most are legal to purchase and use at a middle school age, which is why they're known as the silent epidemic, because people do not realize it's a problem because of these reasons.
The National Inhalant Prevention Coalition is a Texas-based public-private nonprofit agency that provides information as well as prevention methods for inhalant use and abuse. They offer an electronic newsletter, promote positive media coverage, the latest research in the field of inhalant use, create nationwide initiatives, and provide training and assistance on the issue. They also created the National Inhalants and Poisons Awareness Week, which Cass will tell you a little bit more about.
The National Inhalants and Poison Awareness Week has been developed by the National Inhalants Prevention Coalition as a form of education of inhalant abuse to help increase the understanding of the risks and use of inhalant involvement. Conducted on the third week of March, it is an annual media-based program that is presented at the community level. The NIPAW involves many populations and influencers in a community, including youths, schools, media, police departments, health organizations, civic groups, and many more. The National Inhalants and Poisons Awareness Week is recommended for all individuals who are considered substance abusers, including all ages and ethnicities of both genders, and have proven to be effective means of mobilizing communities to reduce inhalant use. Almost 2,000 organizations and individuals from 46 states have participated in last year's campaign. While there are many sponsors that help fund this agency, the NIPAW partners have included sponsors from state government agencies, medical and pharmacy groups, local anti-drug coalitions, faith communities, schools, and many more. According to surveys and examined inhalant substance abuse trends, there has been a continual decline since 2001, mostly as a result of the correlation of inhalant substances abuse and the negative consequences that coincide, as produced by programs such as the National Inhalant and Poison Awareness Week. The success of this effective program may be most primarily contributed to the public education of the effects of such substance abuse, which has ultimately led to the collectively held belief that such substances are harmful and dangerous to use. Now, Phil will expand on the techniques and tips that programs like the NIPAW share with the community.
The NIPAW is particularly known for targeting kids by creating a fun, safe environment in which kids can learn about inhalation abuse prevention while getting to do fun activities at the same time. Just recently, NIPAW has offered opportunities to partake in crafts, games, and social activities while learning about inhalation abuse. The event, called Be a Superhero in the Home, helped kids to learn the importance of recognizing harmful products, as well as teach kids to let parents know of any products that may be potentially dangerous to their health. An iconic superhero, Batman, also made an appearance, and he helped the kids understand how to be a superhero themselves when faced with evil poisons commonly found in the house today. NIPAW also offers helpful tips and strategies for parents and teachers to help make learning about inhalation prevention more exciting. One of the strategies is its Safe to Smell or Touch game, advises teachers and parents to ask their youth to find pictures of common household items commonly found in books or magazines, and further inquire if such products are safe to smell or touch and why. Another strategy that they advise is that they say that parents should not specifically name products that can be used as an inhalant unless the child mentions them by name. By avoiding unnecessary conversations, kids won't be subjected to potentially new ways of inhaling poisons into their body. Thank you.